Hi, everyone, and a very pleasant new year and a prosperous new year. And of course, welcome to The Point by the American Acupuncture Council. I'm very pleased to spend some time with you today. And today we're going to talk about evaluation and management codes. More specifically, when is it appropriate to use them for follow-up visits? So let's go to some slides here and let's get started. And as always, we'll start, we're the American Acupuncture Council. There's the website for our network or the education division. Of course, you can see also my email and site for me as well. But let's get right to the point. Click. There we go. So evaluation and management codes, as we all know, are exam codes. Now, evaluation and management codes often get mistaken because we think of them as just one thing, they're exams. But I want you to notice it does say evaluation and management. And we have two types of codes. We have a new patient and established patient, which I assume everyone's pretty familiar with. New patient, someone you've never seen before, obviously brand new, but also an established patient who's someone you've already seen and doing an exam. One quick note, for a new patient, always remember what we call the 3-year rule. A patient is brand new if you're seeing them for the first time, obviously, but a patient is also considered new for billing purposes when you use or when they haven't been in for 3 years or greater. So we do understand those codes, what means new, what's means established, but I want to get into defining an acupuncture office visit and where this really matches for us as to doing an E&M daily. So an office visit for acupuncture can have many facets, and I think this is where the confusion comes in. People often think of a E&M code as an office visit, when in fact an E&M code is simply just part of an office visit. On an office visit, the first thing, of course, you might do with any patient is just do a little evaluation. How are you feeling today? Check on their tongue and pulse and so on. In addition, you're also going to provide the treatment. And then, of course, post-treatment, you're going to do potentially some counseling. So those are things that you do every single day, hence why you don't bill an evaluation and management, because that's included as part of the office visit. The idea would be, when is it above and beyond this? When can I bill an E&M appropriately? So let's deal with acupuncture. Acupuncture, the codes, of course, we're all familiar with, 97810 to 97814, and of course, that is for manual or electro. They include a pre-service and post-service evaluation that's considered a component of the acupuncture service. And I think this is where the confusion comes in when people have the wrong impression that they can bill for an E&M or an evaluation and management daily. The only time you can bill an additional evaluation and management service is when the condition is significant and separately identifiable, something above and beyond the E&M. So it goes above and beyond the usual pre-service and post-service work associated with acupuncture. Think of it as the pre-service is just, how are you feeling today? And then the post-service is just after you've done care. So here's where we go with it. In pre-service, you're likely going to do some or all of these things. Review the patient's record even before you treat them. You're probably going to do an interim history. Think if a patient comes in, you're going to ask them, how are you feeling today? Is that a little better, a little worse? So in other words, you're going to do a little short interim history. You're, of course, going to prep for care, getting the patient gowned, getting them on the table, doing your exam, if you will. And then, of course, if need be, you might be communicating with other providers when necessary or appropriate. That's probably not typical, but could be. So that's the pre-service. Think of it just the interview. Then the intra-service, of course, is going to be your pertinent evaluation and assessment of the patient. So day to day, it is expected that you probably are going to do some level of exam. Now, as a traditional medicine practitioner, you're not necessarily going to do the things a Western doctor does. You might do tongue and pulse. You may or may not do palpation or range of motion. So, of course, you're going to do the pertinent things that are important to you. You're probably going to discuss the treatment with the patient about where they're at, where they're going. You're going to do the service itself, perform the service. And remember, performing the service includes more than just putting needles in the patient. This whole service includes washing your hands, choosing, selecting points, cleaning, inserting, stimulating the points, removal, and would include, of course, monitoring the procedure as the patient is there. And then ultimately making sure that you understand that the amount of time the patient you spent with retention of needles doesn't count for billing. So that's a little sidelight of this, but do remember, if you insert needles and leave the patient to rest for 10 or 15 minutes, that doesn't count towards the acupuncture. But notice just the intra-service is really just doing the service. Then we have post-service, and post-service is going to include likely evaluation and discussion of the patient. How are they feeling? Is that better, worse? When you finish treatment, I'm sure most often you're asking your patient, how does that feel now? And of course, this can include counseling. Now, counseling with your patient could be simple as talking to them about maybe getting a little more sleep, maybe changing diet. But again, just a few minutes of counseling is expected as part of the post-service. And then ultimately the post-service too includes documenting the service. So while you're with the patient, documenting what you've done certainly is part of it. So hence why you can't bill an exam daily is because there is a little exam built into the code. Realize too, what if you need to make arrangements with another provider? That's part of the post-service as well. That's not something we could bill additional. So ultimately, here's what I want to make clear, because I've had a lot of offices at the American Acupuncture Council, because the insurance company, of course, we provide audit protection for you. And with audit protection, one of the areas we found a lot of problems for offices is by billing an E&M every day causes you great concern, because often you have to refund it because it was not proper. So bottom line, make sure it is not appropriate to bill and code an E&M or an office visit on every visit unless you're doing an exam above and beyond what's normally expected. Okay, think of it this way. On every acupuncture visit, you pretty much are doing a level of exam that's likely equivalent to a 99212 or maybe even a 99213, because those both require anywhere from 1 to 6 bullets of evaluation. And the bullets include things like tongue would be a bullet, pulse would be a bullet, range of motion. So generally you do anywhere from 2 to 6 of those, hence why a small level exam is always included. What I want to make sure though, and this is different, when is it appropriate to bill one on a subsequent visit? Because now I've told you can't bill one daily. Well, then when the heck can I bill one? Okay, well, let's go into those issues. The number one and most obvious is, of course, you have to bill a separate exam on the initial examination. There's no question. Of course, that's separate and distinct. It's the initial issues with the patient. How long has it been there, doing their past history, family history, and so forth. Note it also includes a report of findings. So do always remember, an exam is a report of findings. If you choose to do a report of findings the next day, that's certainly fine, but it would not be appropriate to bill a separate E&M. You simply didn't complete the first day, and it just becomes inclusive. So an initial exam is something specific. But here's another one. When is it appropriate? A routine re-examination to evaluate your patient's progress to the treatment plan is generally done at least once per month, or I would say every 30 days during active care. So if you're billing one every 30 days, you won't have any problems. In fact, that's the pretty much expected time frame. If you look at any treatment guidelines, it's pretty much expected about every 30 days. That would include even for those that might be treating a patient once a week. Here's an area, though, that may come up that's sooner than this 30 days or initial. And notice it says a sudden change in the patient's symptoms, but the change has to be significant enough to warrant an examination. So if someone comes in and goes, ooh, my headache is really bad today, I don't think that would be enough to warrant a new exam. But let's say they were having headaches, but then all of a sudden that headache became very sharp. Maybe they were also having pain radiating to the arm. That certainly would be a significant enough change that there's going to be a little bit of an exam above and beyond, because it's not routine anymore. The fourth one that I do think is obvious, though, as well, is a new incident. Obviously, a patient comes in on a Friday with headaches. You treat them, they're doing pretty good, but then they come in the next Monday or Tuesday complaining of low back pain. Clearly, in that instance, it would be appropriate to bill an exam, because evaluating the low back, though it may not be a high-level exam, is certainly new and different from the area you treated prior, which